Thank you for joining us for a review of the NOF and NBHA Quality Improvement Registry. We will begin today's presentation with a review of the Qualified Clinical Data Registry, then review the registry's measures and features. After we walk through the different features of the registry, we will provide additional information on how to access the registry and support contact. The NOF and NBHA Quality Improvement Registry is classified as a Qualified Clinical Data Registry, which was introduced in 2014. The QCDR method provides a standard to satisfy PQRS requirements based on satisfactory participation. This type of registry collects medical and clinical data for the purpose of patient and disease tracking to foster improvement in the quality of care furnished to patients. The data submitted to CMS via a QCDR covers quality measures which are not limited to PQRS measures across multiple payers and is not limited to Medicare beneficiaries. Reporting through a QCDR entails reporting at least 9 measures over at least 3 national quality strategy domains, with the inclusion of at least 2 outcome measures. If less than 2 outcome measures are available to an eligible provider, report on at least 1 outcome measure and also at least one of the following types of measures: patient safety, resource use, patient experience of care, and efficiency or appropriate use. As I mentioned, a QCDR is not limited to PQRS measures and may include up to 30 non-PQRS measures. We will now review the measures available within this registry. The NOF and NBHA Quality Improvement Registry is comprised of 38 quality measures. The 16 non-PQRS measures are listed within the table on this screen. The PQRS measures available within this registry are available on this slide. The NOF and NBHA Quality Improvement Registry is accessible online through the MedConsort platform. To review eligibility for participation in the PQRS program, review the current list of eligible practitioners. Essentially, anyone who bills Medicare for Part B covered services is eligible for PQRS reporting. The NOF and NBHA Quality Improvement Registry, in collaboration with CE City, is intended for all providers and specialties caring for patients with osteoporosis. The registry will provide participating providers with timely custom continuous performance monitors, performance gap analysis and patient outlier identification, access to improvement interventions to close performance gaps, including patient care management tools, targeted education, resources, and other evidence-based interventions, and comparison versus registry benchmarks with peer-to-peer comparison. After registering for the NOF and NBHA Quality Improvement Registry, you will be taken to the measure selection page. The NOF and NBHA Quality Improvement Registry is comprised of 38 quality measures, including measures for laboratory investigation for secondary causes of fracture, risk assessment and treatment after fracture, discharge instructions for the emergency department, osteoporosis management in women who had a fracture, and osteoporosis testing in older women, and hip fracture mortality rate. As a participant, you can choose to enter data for all measures and review performance before selecting the measures for submission to CMS at the end of the reporting period. If you prefer to enter data for the minimum, select 9 measures. The measure counter will let you know when you satisfy the 9 measures over 3 NQS domains with the inclusion of 2 outcome measures. You can select as many measures past the minimum requirement as you choose. Only the measures you select will be available for submission to CMS, and you will be prompted to enter data for only those measures. To ensure the measures you select are applicable for your practice, you can download and review the full measure specification document, which lists the diagnosis codes, CPT codes, and other information necessary for reporting the measure. You can also click the information icon next to each measure to review the measure descriptions. We will now review the data entry options available through this registry. To add patients manually using the web-based form, click the Add a New Patient button from the Data tab of the registry site. To complete data entry via the online forms, input the eligible patient information through the web form provided. With each patient entry, input the requested information. Information requested will include the encounter date, related codes billed for that encounter, and questions regarding that visit date. Continue to add patients and encounters until you've entered at least 50% of your eligible patients per measure. As you enter each patient and encounter, your progress will be updated in the data dashboard. If you would rather upload your data into the registry, click the Upload Patients button. To begin the upload process, download the templates available within the registry. This will include the data template and definition file. The following slides will illustrate the data upload process. Please note that if you do have difficulty uploading your data, resources are available to you through the CE City support team. The CE City support team can be accessed by clicking the support link on the MedConcert website. To begin the upload process, you will first need to download the data templates. Note that the template has been updated for 2015, and you should not use a template from any previous year. The template contains the correct column row headers, which correspond to the required data elements. Place the appropriate data into the template and ensure that the columns match properly. Editing the template column headers will cause errors during the upload process. The definition file is available for download if you need assistance with the data template. The data template is the file that you will need to populate with your PQRS data. You can populate the template in any way you choose. This file can be populated through an automated report set up within your electronic system or even manually. The template should be downloaded and saved with the information you extract from either a patient's chart or your electronic system. The definition file provides instruction and specifications for populating the data template. After your data is collected within your spreadsheet, you then upload your file. First, select the Upload Data button and then browse to find your data template. Ensure that you save your file in a location where you can easily retrieve it when you are ready to upload, and remember to back up your file in a secure location. The data upload queue appears when you upload a patient or data file. You can review all of the information that you've uploaded into the system through this queue. This will give you information about valid records that have been successfully uploaded. And if any errors have been encountered, the data queue produces error files which define any entries which may need to be removed or updated. The standard data services available within the registry are the manual data entry through online forms and the data upload process through the Excel templates. Optional data services include EHR integration and data loading services where you could send your data to CE City to load into the registry product. If you'd like to add an encounter to a patient that's already been entered into the registry, click the Add Existing Patient button. To add a visit or encounter to a patient already existing in your registry, you can search for them by their name or ID number. Once located, click the Add Encounter icon to add a new visit or encounter for that patient. We will now walk through the performance management features within the NOF and NBHA Quality Improvement Registry. To manage your registry performance, click the Performance tab of the Registry dashboard. The registry will calculate and display each measure and quality score in the Performance Monitor. Additionally, the registry can generate performance measure gaps and lists of patient outliers, as well as link to interventions and improvement tools. The registry is configured to aggregate measure scores at the measure level on a daily basis. The registry provides analytics at the provider level. Pictured on the screen here is the provider level dashboard, which includes each measure being tracked, performance score trend lines, quality measure scores, and measure gaps, which are compared to practice and national benchmarks where available. Quality improvement is configured at the measure level. Now, let's review how to improve performance through the NOF and NBHA Quality Improvement Registry. Once a measure gap is identified, the Quality Improvement Registry automatically identifies improvement interventions. The green How Do I Improve button associated with each measure links to relevant improvement tools, including relevant clinical guidelines and continuing education materials. Your patient population is broken down by patient within the registry. We will now overview your patient list and alerts by patient and measure. The master patient list includes the list of patients loaded into your registry. Review the Alerts by Patient section of your patient population to identify patient outliers. The indicators you view here represent the most recent updates made to the registry for each patient entry. By reviewing the Alerts by Measure section, you can review feedback at the measure level, as well as the measure score breakdown by patient within that measure. Now, we'll review how PQRS, Maintenance of Certification, and MU2 Specialized Registry Reporting can be satisfied within your registry data. The NOF and NBHA Quality Improvement Registry, in collaboration with CE City, is approved by CMS as a Qualified Clinical Data Registry, or QCDR. A QCDR is a registry comprised of PQRS and also potentially non-PQRS approved measures, which qualify as a CMS-approved reporting tool for PQRS. The NOF and NBHA Quality Improvement Registry is a QCDR with 38 quality measures, 16 of which are custom quality measures designed specifically for practitioners providing care for patients with osteoporosis. To satisfy PQRS requirements with your registry data, ensure that at least 9 measures are selected that cover at least 2 outcome measures and 3 national quality strategy domains. Report on 50% of your eligible patients per measure and complete an attestation for submission to CMS. Maintenance of Certification, or MOC, acknowledges the growth and complexity of medical science, clinical care, and the importance of the physician's relationship with the patient in delivering quality clinical outcomes. It also requires proof that a physician has the practice-related knowledge to provide quality care in a particular specialty. The NOF and NBHA Quality Improvement Registry offers participating physicians the ability to reuse their registry data in the form of board-ready reports for self-directed performance improvement modules for MOC. Successful enrollment and submission of data to a qualified clinical data registry for the purposes of satisfying the meaningful use menu measure for specialized registry reporting is contingent upon submission of data directly from certified EHR technology to the registry. Providers who would like to achieve the meaningful use menu measure for specialized registry reporting will need to connect their EHR directly to the QCDR. EHRs interested in submitting data to a QCDR should contact CE City directly for more information on how to get started. If you need assistance with the NOF and NBHA Quality Improvement Registry, contact us for technical support. Click the support link on the NOF and NBHA Quality Improvement Registry MedConsert webpage, or for questions about the registry, please email Debbie Zeldo at debbie.zeldo@nbha.org.